More on the state of the hospitals in New Jersey right now. Joining us on the phone is the president and the CEO of Atlantic Health Systems, Brian Gragnolati. He oversees numerous hospitals across New Jersey, including Morristown Medical, Overlook Medical Centers, and Goriev Children's Hospital. Brian, appreciate a few minutes here on News 12 New Jersey. First off, how stressed are your hospitals right now? How are your doctors and nurses holding up?
Thanks, good for having us on today. The quick answer to your question is we are very stressed. Our team members are doing just an incredible job of caring for our communities. And for example, today in our hospitals, we have almost 900 people who are under our care as inpatients, and about 35% of them are in critical care units that we've had to develop. We've had over a doubling of our critical care capacity. And many of those patients, most of those patients, are on ventilators.
Yeah. We've seen a consistency in the number of cases statewide. We've been in that 3,000 to 4,000 range now for several days. I'm wondering how this actually manifests itself in the hospitals. Are you seeing the same number of patients come in on a daily basis? Are you seeing less patients?
So a couple of weeks ago, we were seeing a doubling of the number of patients every day, every 3 days. Over the last week, our growth has been in the single digits, and over the last 4 or 5 days, it's been under 5% or in that area. So based on the modeling that we've done, we think that we are getting close to what is described as the apex of this. And then the real question is, when it plateaus, how high will our case rates be? How full will our hospitals be? Because that's driven by two things. It's not just the growth in cases, but it's how long these patients stay. As I said, 80% of the people that get hospitalized, or 65% of the people that get hospitalized, end up, doing fine. The people that are in their ICUs on ventilators end up staying in the hospital a very long time, and there's a stacking up that occurs. So even though we may be getting close to an apex, we will have a long period of time where our facilities are very, very busy, and that's what we have to stay focused on.
Yeah, as you mentioned, this coming apex of cases, when you do the modeling in terms of PPE and ventilators, how are you stacking up in that regards? Will you have enough?
So the way the chain works on all of this is it all starts with testing and making sure that we have access to the testing we need. And that has been a struggle from the beginning and continues, although it's gotten a lot better. The second piece of this is to make sure that you have the protective equipment for team members. And the governor and his team have done a very, very good job in supporting our hospitals and health systems in making sure that we have the things that we need in order to protect our team members. But as the governor says, there's never enough because there is a national shortage.
Yeah.
The third thing is having the facilities to do that. And we've had to empty out our hospitals of most of the other types of care we provide in order to do this. But the most important ingredient for all of this are team members and making sure that our doctors and nurses are there to care for our communities. And that is getting stressed because our team members are getting sick. And this has been going on for a long time. But I have to tell you, I'm so proud of what everybody's doing. And there's just so many great stories of teamwork and collaboration and how different people are doing different things that I am confident that we are going to work through this and come out very successfully.
As we sit here on late afternoon on April the 9th, what is your greatest concern right now as we move forward?
Going into the weekend, we are concerned about staffing. And the reason we're concerned about staffing is that we continue to see our case counts grow. And we continue to see our patients stay in the hospital, although we are seeing more people getting off the ventilators and breathing on their own. We have had about 600 people transferred from the hospital back to home or other settings. So we want to make sure that our team members are there and supported. The other thing I worry about every day is that we're going to see hotspots pop up. And your earlier segment about nursing homes is one of the major areas of concern that we have, because when that happens in one of our communities, that has a big impact on the hospitals that we have in those communities.
Well, Brian, I know you've seen the shows of affection from communities around the state, the first responders that have been coming by. I saw it at Overlook Hospital there in Summit. The first responders had a parade just to salute the healthcare workers. You've been getting this just great outpouring of support from community, and just pass that along, if you would, to your first, your doctors and your nurses and your ERs and your ICUs, that, we support those folks more than ever right now. They're very much our healthcare heroes here, and we just can't say enough about the job they're doing right now.
You're absolutely right. They are the heroes. But let me tell you what the heroes want to see the public do. They love the accolades, they love the thanks, but they really want to see people in our communities socially distance, follow the rules, because that is the only tool we have in our kit right now to keep this virus from spreading. So if you want to thank a caregiver, thank a hero, do what the governor's telling us to do, which is to commit to staying distance, because that's a way that we're really going to beat this thing down. And thanks to the communities for taking that to heart and doing everything they can to make that happen.
Brian, thank you for a few minutes.
Thank you.
Brian Gragnolati there, President and CEO of Atlantic Health Systems, with us here on News 12.